couple of you asked me to make a video on the nausea and vomiting thing like I did in class, so that's what I'm going to do here. We'll start out with talking about the vomiting reflex. In order to vomit, we have this vomiting reflex initiated from the vomiting center in the brain. But what happens during the reflex? Right down here we have pyloric sphincter. And up here we have the lower esophageal sphincter. So, pyloric sphincter down here tightens, so it contracts. Pyloric. Contracts, and the lower esophageal sphincter opens. In other words, it relaxes. So this closes up, food ain't going to go this way. This opens, food can go that way. The diaphragm contracts. The abdominal muscles contract. Right? Push everything up. We have the epiglottis closes. And we have increased salivation. Salivation. So what happens during the vomiting reflex? Well, pyloric sphincter down here, this is the stomach. Pyloric sphincter area closes up. The lower esophagus relaxes. Right, that makes it so food isn't going to go this way, but it'll go that way. The diaphragm and the abdominal muscles contract, push the stuff out, and then the epiglottis closes. That way nothing will go down into the lungs, and we have increased salivation. So that's what happens when we vomit. Before we can talk about antiemetics, we have to talk about what goes on in the brain. Right? So this here's supposed to be a brain, right? You have the brain stem, the pons right here, brain stem. When you come down, and you start down here in the brain stem, I'll start with the vomiting center, right? Right here, the vomiting center. I drew it out here so that you can see the vomiting center it has muscarinic receptors, right? Muscarinic receptors, right? Which are, acetylcholine is the neurotransmitter to activate muscarinic receptors. And then we've got the chemoreceptor trigger zone. Right back here is the chemoreceptor trigger zone. Right? And it has dopamine receptors on it that activate it, and it has serotonin, or which is 5-HT serotonin receptors. There's a lot of different types of serotonin receptors, and so these are a specific kind here in the chemoreceptor trigger zone. And then up here we have the vestibular nuclei that we'll be talking about. Vestibular, it comes from the vestibule in the inner ear, and that there. So now we're going to talk about the steps that happen in the several different kinds of vomiting that occur. First of all, when the muscarinic receptors in the vomiting center are stimulated, they will stimulate the vomiting reflex. Now we have over here the chemoreceptor trigger zone. And you might think, why do we have to have two different zones to initiate vomiting? There's actually a pretty good reason for that. We have the blood-brain barrier. The vomiting center is inside the blood-brain barrier, right? It's a barrier that goes all the way around the brain. Right? Comes down through here. Right? So if you look there, the chemoreceptor trigger zone is outside the blood-brain barrier. The chemoreceptor trigger zone lying outside the blood-brain barrier is a very strategic location. That way anything out in the blood that is being blocked, and hopefully being blocked, toxins are hopefully being blocked from getting into the brain, but the chemoreceptor trigger zone is sitting outside there, so it can detect them. So it detects toxins in the blood and then sends an impulse to the vomiting center, and the vomiting center initiates the vomiting. So if we've got something inside our system, right, we've got some kind of toxin, and the chemoreceptor trigger zone recognizes that, it says, hey, there's something in our system that we don't like, good chance it's coming in through the stomach, let's make him vomit. So boom, it sends the message over to the vomiting center and you start vomiting, right? Now, you might have been given a medicine IV, so it didn't come through there, but the chemoreceptor trigger zone doesn't know that. As far as it's concerned, there's something in here that's not normal, we don't want any more of it, boom, make him vomit. You got to remember too now, the receptors here that get stimulated, you've got the dopamine, I believe they're dopamine 2 receptors, and you've got the 5-HT serotonin receptors that get stimulated here in order to cause this vomiting. So they notice the toxin, boom, they send a message over to the muscarinic receptors. Acetylcholine is the neurotransmitter used to do that, and then the acetylcholine stimulates the muscarinic receptors, and the vomiting center stimulates the vomiting reflex. That's how we get nauseous and vomit when we've given a lot of medicines to people, right? Because we're putting them in as far as the chemoreceptor trigger zone is concerned. That's poison, right? It's something that it doesn't want in the system. So a lot of medicines that make us nauseous and stuff, this is where the mechanism starts. The mechanism of vomiting will start here at the chemoreceptor trigger zone with the 5-HT serotonin and stimulation by the toxins. Let's talk about motion sickness, right? You get nauseous for motion sickness. Same mechanism causes morning sickness. Motion sickness and morning sickness. I don't really know that much about morning sickness. Something to do with your the increase in progesterone stimulates this reflex in the inner ear, and it stimulates the vestibular nuclei, and the movement does. So you have the inner ear. So this guy here has the little hairs in there, like you learned in A&P. He's got the little hairs inside the inner ear, and when you move around, those little hairs move around, and they let you know what position you're in, right? And that these messages, and they all stay in line. As long as they're staying in line, and the position you're in matches up with what you're seeing, you usually do okay. Go down to Disneyland and you get on a few of those roller coasters or these rides that take you and throw you all over the place. Well, that's a lot of stimulation there, right, in that inner ear, right, because you're really moving around. So it moves around and it gets kind of jumbled up, and it will end up stimulating the vestibular nuclei and make you throw up. Or another one, sometimes you maybe aren't moving that much. You're in a car or something, right? Your system is sensing that you're moving, but what your eyes are seeing, especially if you're in the back seat, what your eyes are seeing is just the back of somebody's head or the back of the front seat, and it's not moving. You're staying still as far as what your eyes see, and it doesn't match up, right? And that confuses the center, and it ends up stimulating the area. In that case, a lot of times you can just reposition the person, put them in the front seat. I mean, you may have a friend or something that says, I can't sit in the back, I get nauseous and start vomiting, I have to sit in the front, and that's why. Right? So you get this confusion or this stimulation up here in the vestibule, the labyrinth, and then the vestibule within it gets this and sends this message out, right, via the cranial nerve number 8, not important, but all you want to know is that the inner ear gets this message and stimulates the histamine receptors of the, so that means that it creates histamine, because histamine is the neurotransmitter for histamine receptors, and so it stimulates these receptors here, and these receptors will send a message to the vomiting center using acetylcholine. So you got your histamine receptors being stimulated here. It stimulates the vestibular nuclei, which are right here, and then they're going to send the message just right here, right close to it. They're in the pons. This is the brainstem. Boom. They send that message over to the vomiting center, right? Stimulated, histamine stimulated. Boom. Acetylcholine comes down and stimulates the muscarinic receptors, stimulate the vomiting reflex. So you think that this here, there's a couple different medicines that might work. Might get an antihistamine like hydroxyzine or promethazine, might block right in here. Right? Might block the histamine stimulation of the vestibular nuclei. Or you can give an anticholinergic, right, which will come down in here and block the stimulation of the muscarinic receptors in the vomiting center and stop the vomiting reflex from being initiated. Okay, and then there's just one more mechanism of vomiting that I want to talk about, and that is, let's go ahead and draw right here. There's the stomach. So we have the stomach. Toxins go in the stomach. Let's say you eat something that's crappy, and what happens is it stimulates some receptors in the stomach, and they also use the 5-HT serotonin, right? Stimulate the vagus nerve, which goes, boom, up here, right? So you got 5-HT receptors in here, just like you do in the chemoreceptor trigger zone. Stimulates the vagus nerve. The vagus nerve releases acetylcholine up here and stimulate the muscarinic receptors. The muscarinic receptors initiate the vomiting reflex. So when you eat something that you shouldn't have eaten, that's what happens. Another thing that can stimulate this sometimes is overstretching the stomach. But let's say if you get a paralytic ileus and you start getting, right, you're not moving things through there and the stomach gets stretched, a lot of times then these can be stimulated and start that whole process. And I said that was the last one, but actually there's one more mechanism of vomiting that I want to talk about. And that is up here where we think. Right? Where we think. We do our thinking out in the cerebral cortex, higher areas of the brain, and up there we can actually initiate vomiting by things like smells, what would I say? Well, I'm just going to say sight, really ugly things. Right? Some people, they see blood and it makes them nauseous. And memory, pain, memories, and all these things here come in here and they send a message straight on down here to the vomiting center. And one thing about this here, it's kind of harder to control with medication, because it's all happening inside the blood-brain barrier, and most of our medicines don't cross the blood-brain barrier. So a lot of times what we'll do, the best treatment for something like this is actually like a benzodiazepine, Xanax or something, just to calm the person down and try to get them so that this doesn't happen up here in the higher levels of the brain and send the message down to the vomiting center, right? But we know that, really putrid things can do that, or just anxiety or really nervous and stuff, and you can stimulate this not remembering things, right? You go out, really tie one on in the morning or at night, and then in the morning you're out and you kind of don't feel too good, and a beer commercial comes on, boom, right? You feel sick. Well, that's all memory, and it's all from up in here that comes down and stimulates the vomiting center. Well, we get antihistamines. There are some different antihistamines: hydroxyzine, promethazine, metlazine, scopolamine, and these are antihistamines, anticholinergics. So they're going to work really well on things in the inner ear. And so what's that? That's motion sickness, right? Inner ears are motion sickness and morning sickness. So this hydroxyzine, promethazine, meclizine, these zine medicines will usually work really well on that kind of vomiting. Now we also have another real popular type of anti-nausea medicine, and that is the 5-HT serotonin receptor blockers. And these guys end in N-citron. And an N-S-E-T-R-O-N, right? Citron, I guess. So the big one is on here, ondansetron, right? O-N-D-A, ondansetron. And that is most common brand name is Zofran. So ondansetron is a 5-HT serotonin receptor blocker. So it's going to be really good on somebody who's in chemotherapy, right? It'll do a good job blocking these chemoreceptor, this chemoreceptor stimulation, because you have the 5-HT serotonin receptors in here. So, and another thing is, they'll very often when you give morphine, a lot of times you will give morphine and you'll give ondansetron or Zofran, you'll just give it right with the morphine. You give the morphine and give that, right? Because you know that the morphine is going to come through here, it's going to be in the blood, this is going to detect it, say, whoa, let's vomit, boom. But by doing this, you can block these 5-HT serotonin receptors, and so they won't pick this up. They won't get stimulated because they're being blocked, and the message won't go forward. And it also works really well on things when you put something in the stomach, if you give them some of this first, because you can see that we also have the 5-HT receptors in the stomach, so you can block those receptors from picking up whatever it is that you're giving the person. If you're giving them, you have to give them some medicine or something every day that will make them vomit, or let's just say their stomach becomes really sensitive and these guys get really hyperactive, you can block the 5-HT receptors with ondansetron or one of these 5-HT serotonin receptor blockers. Ondansetron is really the only one that I'm familiar with, I think, anyway. I want to talk about a couple other ones here, and that's metoclopramide. Because metoclopramide, it has a little bit of a unique action. In one sense, it blocks the dopamine 2 receptors, which are here on the chemoreceptor trigger zone, so it can decrease the stimulation in the chemoreceptor trigger zone, so it will work on when you have you're giving medicines and things like that. But it does something else, and that is that it stimulates down in the gastrointestinal tract. It kind of stimulates activity down here. It relaxes this. Remember when we vomited, the pyloric sphincter clamped down, and this guy relaxed? Well, dopamine clamps this down and opens this guy up and increases motility, so it can kind of start pushing things through if you have something in there, and at least you can get a chance to reverse this mechanism. Works really good post-surgery a lot of times, because you're getting both the chemoreceptor trigger zone being blocked, and you're getting you're actually stopping this here relaxation and contraction, and you're starting to move things again, because that's what anesthesia, general anesthesia mainly, it's really big on doing that. The gut just kind of sits and then nothing's happening. Well, if you can stimulate some movement in there again, a lot of times you can get rid of the nausea. So that's Reglan metoclopramide. Right? Reglan is the most common brand name. you'll see on metoclopramide. Another one is droperidol. Droperidol is also a dopamine 2 receptor blocker, right? So it will, and it works well. Anything that's working with the chemoreceptor trigger zone. Occasionally, if the droperidol doesn't work, they can use haloperidol. Haloperidol is always used as an antipsychotic, so I never even knew that it was an antiemetic too, because it's just commonly used as an antipsychotic. But it makes sense, you know, when you think about what it is. It's in the same category here with droperidol, which is commonly used for anti-emesis. But yeah, so probably the most common one here used is the ondansetron. Seems like Zofran is used a lot. It doesn't have a whole lot of side effects. You know, and we do also use, a lot of times we'll use some steroids like methylprednisolone or dexamethasone. We use some of those along with these medicines, and they'll even cut down more on the side effects. And the steroids don't usually have an initial bad side effect or something that you don't want them to be on for very long, of course, because and that's a whole different class to talk about that. But so this is our vomiting. It's how it occurs. I think I've told you everything I want to tell you here. Yeah. Okay, so that's it.